ask both Senator Graham and Senator Scott if they'd like to share some of their thoughts with us, and would love to hear from them.
Well, thank you. We're from the federal government here to help you.
Hey, thanks for the check.
Yeah, that actually may be true for a change. So, one, Henry, thanks for having us. We talk a lot, and from my point of view, Governor, you've done a really good job of getting input from business people, input from doctors and nurses and healthcare professionals, and the general public, and you've got a hard decision to make, and I think you've done a good job. We're sort of looking for the Goldilocks solution here, just right, not too cold, not too hot. Well, this May 11th or May 18th, when we start going back to restaurants, is important. Everybody wants to get back, but the goal is to open up business without overflowing the hospital. I think South Carolinians have been very dutiful in following the governor's guidelines. We've made a lot of progress. I feel better that there's light at the end of the tunnel. There's a big announcement today about a drug therapy that has a lot of promise that can take this from a 10 to a 1 or 2. And people are going to feel better going out when they realize if you get it, you're not going to die. And a vaccine probably comes next year, and it'd be more like the flu. Nobody shuts their business down because of the flu is a general speaking proposition. You have a vaccine for the flu, and we build up immunity over the years to flu, but still people get it and they pass away. There'll come a day where this virus is much like the flu, is something you can control. Until then, we're just going to have to navigate uncharted waters. I've never known a situation where you take the strongest economy in the world and you literally flip a switch and shut it off, and you try to turn it back on, and everything you need to turn it back on gets to be pretty complicated. The unemployment benefit problem. Tim and I were being briefed about the bill. You know, spending $2.3 trillion in 3 days is not as easy as it sounds. So they were explaining the bill to us, and Tim and I were together, and I said, excuse me, could you go over that first part again about unemployment? It hit me like a ton of bricks. My dad owned a bar, a liquor store, and a pool room. I have walked in your shoes. What have we learned? If you pay people $23 an hour not to work, they will take you up on it. It doesn't mean they're lazy. It means if you're going to pay them $23 not to work, they'll probably take that over $17 to go to work, even though people like working. So July the 31st is when this expires, and I promise you, over our dead bodies, this will get reauthorized. We've got to stop this. You cannot turn on the economy until you get this aberration in the law fixed. Your challenge is, what do you do between now and July the 31st? You don't want a bunch of people coming back pissed off at you. And a lot of people are probably wanting to come back and might even take a reduction in pay to do it. Whatever you can do here on the ground to let people know that once you've got a job available, you lose your benefits, it's probably smart to enforce that in a practical way, but not go too far to create a war between the employer and the employee. The goal of all this was to help people, and our goal, Tim and myself, is to pay you no more in unemployment than you were making at work, to give you 100%, but not to give you a pay raise. We'll fix that, but it's going to be August. Liability protection. Having been in a small business family, nobody sues you if you get the flu. But we need to think through, when you open back up, what are the risks you're running with your employees and your customers? So Mitch McConnell has said if there's a phase 4, which there probably will be, business liability protection will be a centerpiece of that. So to my friends at the state level, Tom, y'all might want to think about some safe harbor. If you're following the guidelines that the industry, say the hospitality industry, comes up with, and the governor's group blesses, and you follow that, you're immune from a lawsuit. We're going to have to think about how to reopen without everybody in town getting sued. Phase 4 is going to be more difficult politically. A lot of states have not done what South Carolina has done, which is manage the money. And the revenue is taking a hit here, and I want to help states and municipalities, but we can't turn this into a bailout for states who have problems unrelated to the coronavirus. There might be another round 3 of small business loans. Tim was one of the architects of this. It's saved a lot of people from bankruptcy. It's by no means been perfect, but I think it's been a very net positive, and I appreciate what Tim has done. If there's a round 3, it's going to be smaller, and it's going to be more focused on Main Street, so the bigger companies can't take advantage of it. From my point of view, the summer, the virus is going to be in retreat. Hopefully the humidity will do a number on it. It's likely to come back in the fall, but between now and the fall, I think we'll be in much better shape. There'll be drug therapies that can treat it, so people are not so scared of it. Next year there'll be a vaccine, and between now and the summer, we should do everything we can as a nation to rebuild our medical supply chain. I'll end on this. I talked to the Milliken Company yesterday. They're making a bid through FEMA to make $20 million worth of medical gowns. They're competing against Vietnam. So I'm going to do everything I can with Tim to get the medical supply chain in the United States outside of China. This has been a wake-up call for us as a nation that we're not as prepared as we should be. I'm afraid another one of these things will come down the road, but my hope is that if it does, we'll be much better prepared than we were this time. Thank you.
May I interrupt
Yes.
Senator Scott for just a moment to touch on a point, Senator Graham? On hospital beds, the numbers are these, and we have had great cooperation and innovation by all of the hospitals, and we asked them to reduce elective surgeries, not to close them. We didn't mandate anything, and they responded wonderfully. Usually, as I recall, the occupancy rate for beds is about 85% or something like that. Well, the acute care beds in, I think it's 68 hospitals, the beds available, 4,582 beds occupied, 6,518. So they're at 59.8% capacity. So the reason for asking for that cooperation was to have plenty of beds and ventilators for a surge. Well, we have plenty of beds and ventilators for a surge, and that capacity in some other states is the reason that some of the other states are now moving out of some of their restrictions, because the main thing they were worried about was having plenty of hospital capacity for a surge. They have it, and so they're now removing restrictions. Our hospitals and health professionals have done a magnificent job of being open and ready.
Thank you, Governor, for your leadership as well. No doubt you have done a really good job, and the entire leadership team, frankly, in South Carolina has done a fantastic job. It's certainly exciting to live in a place where you can look around the state and you know that you're part of a family. And when I talk to business owners who are crying on the phone because they've been able to keep their employees on the payroll because of the PPP, it's just heartwarming. When I hear, Lou, you talk about bringing your folks back to work and having their kids in the workplace and not seeing them as a burden or a nuisance, but finding a way to be proactive as opposed to reactive and creating an environment that's conducive for learning and keeping the employees focused, which is a really important part of the equation, especially when you see that the capacity from our child care is down more than half. That's just really good leadership on our corporate side as well. So thank you for that. Federal government, let us pray. The unemployment benefit is wreaking havoc and will continue to wreak havoc until it's over. That's one of the challenges that we have. We've unfortunately created a perverse incentive that really harms the relationship between the employers and employees. And I will say to the nonprofits, one of the best things we did, I think, was to include in the PPP the nonprofits in our churches, because the front line of the emotional scar tissue will be dealt with by a lot of our nonprofits who also have everyday work to do. Now you're going to have an explosion of more to do. So it's good to make sure that those folks are included. And Helen, I'll say to you that if I was looking at a slogan, I'd put you on the slogan number one. You'd be the face of the slogan for South Carolina's Open for Tourism one day, God bless it. Southern hospitality is still alive and well. We just have a measuring stick that you need to bring with you. So thank you for your forceful resilience as it relates to reminding all of us that C6s should be a part of the Triple P. And I hope that Phase 4 will include those organizations so as to provide the resourcing so that we can get these heads in beds. My focus on the President's task force is around retail, restaurants, and rooms, hotel rooms. So if we can get our economy back up and running, then we'll have the kind of resources necessary to meet the needs of the folks here at home in South Carolina and, frankly, bringing more folks to our country, probably from other parts of our country. I don't necessarily consider parts of it part of the country. Anyways, I would simply say this as I close here, is that when you think about how we do that, I've been talking about an incentive-based economy where we actually take a second look at those tax deductions that may encourage business travel, eating out in restaurants. So one of the things I think we have to redesign perhaps for the rest of this year is an incentive-based economy so that we have more tax incentives that leads to more heads in beds, more seats at tables, even if they're 5 feet apart, and more folks shopping and spending the money. We are a consumer-driven economy, and if we don't keep the focus on the main thing, we might find ourselves with an anemic recovery, which is not good for anyone. I think that's about it. I do think there's a couple of things that are in Phase 4 that Lindsay's already touched on, so no need to do a half-baked job when Lindsay already baked the cake.
Senators, thank you, and again, thank you for, we always know that you've got South Carolina's back in Washington, and we appreciate that. As we close out today, and I think Jennifer and Helen, thank you for your leadership and driving our discussion today. I think it was very helpful. I would encourage, as I've said all along, and as my charge has been from the governor, is that this is a collaborative group, right? Reach out to your spheres of influence. Those are the things that are important to bring back so that we understand and can help in making recommendations and as decision-making takes place.